Scopan. So, yes, I'm coming live and clear, and this is topic of the day: how to assess unconscious patient. Sometimes assessments of unconscious, you can do this thing even if you are not a medic. It's very important when you get to things at home, places that are not hospital based or healthcare centers based, and you can try and help or do something. It is very important. This topic is very important. And if you may see this week, we have dealt so much with emergency issues and how to approach the emergency issues when someone is not medic, because there are things that happen at home, and they really frustrate us as a society. So okay, let's continue today. I think next week now we'll come more more trajectory issues, complications, how to do A, B, C, D, how to do this, how to do that. But this week has been all of first aid management, helping unconscious person. First aid is very important because it may make someone not to lose life or be permanently disabled. And that is, if you may listen carefully this week, that is what I've been doing. Not to make people to lose life or to be permanently disabled. It's very important to help people not to lose life. Very important. But sometimes you see at the when you find someone is when I sometimes I say non-responsive, and people ask me, "What are you telling us, doctor?" I say non-responsive person is a person who you've come in office, you find this person lying on the table, you try to call this person, is not waking up, or at home. So today is how to assess unconscious patient. You see, you've gone home, you've find someone, maybe it's your house help, maybe it's someone who you are close with, and you've tried to wake this person up, and this person is not waking up. How do you assess this person? How? There it is step by step. Hmm? Airway, some people say airway, breathing, A, B, C, D. Hmm? You check for airway, breathing, circulation, and disability. If this person is disabled, and sometimes it's good to know some technical tips, some technical tips, and that is what today we will be speaking about. The little things, some things that we can help when you are at home, and someone feels good and nice. There are so many texts that have come of specific topics. You see, before we I present, you need to come up with a draft. You check how to present it shortly and make it easy for someone. Those topics, I've seen them, and we will discuss them very soon. For those who have emailed me, thank you so much, and always thank you coming to this platform, because here is where we help people to live a good life. And good mental health, I usually say, is a step next to not going to hospital. You see, going to hospital, if you have a nice mental health, even your immunity comes on strong. Your immunity flourishes because of good mental health. But nowadays, the things that are happening, and several things have meant the mental health of people to deteriorate. And you see, that is the main thing when it comes to health, your brain and your emotional being. We pray God everything to be good, mostly when it comes to finance and living, cost of living. Just pray God that the world finds a solution. Now, let's embark to the main topic. The main topic here we said is how to assess unconscious patient stepwise. Ensure the scene around is accommodative. Hmm? You get there and there are so many people. Tell the people to step aside, give aeration, let there be oxygen around. If it is a house that is or it is not aired correctly, open the windows. If it is fumes, make the fumes go away. The first step, that is the first step. Check responsiveness. Call loudly, shout. Will this person who is unconscious respond? Will this person who is unconscious respond? Gently shake this person gently. Will this person respond to the shake? Because if you shake someone gently, ta 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 ta, okay, like let's say we give a name like Mike, you shake as you shout, Mike, 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 Mike. Is this person responding? That is the first step. You have made the condition safe. Now you try to check if this person can respond. You call for help. You get it? Calling for help is important, even if they come and find that that person is awake. Something will be nice in this way. The emergency people who are medics will try and advise more according to the condition this person has found. Now, step two, airway. You check the airway. Is there airway open or is there any blockage at the airway? Because you see, sometimes choking and getting some things and blocking the airway can cause unconsciousness, ischemia, lack of oxygen. You can lack oxygen and faint. You can lack oxygen and faint, which is a complication. Look for vomit, blood, foreign bodies around. You check for some vomit. Did this person take something and because you see, when you take something and you get unconscious, you can vomit. Maybe poisoning, organophosphate poisoning, like some people take the anti-pest insecticides. They are called insecticide. A child, and then mistakes it to be milk you drink, and then you start vomiting, and then you go unconscious. You check if there is such kind around. Vomits, foreign bodies. Maybe this person tried to vomit. You see, I don't want to say that name. I don't like it. And then this person is unconscious. Is there blood spot on the floor? Hmm? Did this person see? Those are the things that you should look, because when someone is bleeding, there must be high chances of blood on the floor, and then this person losing oxygen in the brain, and then you get unconscious. You see, like we call it hypovolemic shock. Losing blood, the volume becomes low, so we call it hypovolemic shock. Head tilt, chin lift. You head tilt and then you chain lift a bit. Head tilt and you chain lift. You check if the airway is okay. You check if the airway is okay. You check something called oropharyngeal airway if needed. You see, but this one is for medics. For medics, insert oropharyngeal airway. That one is for medics. You don't do what? You don't start doing that. You wait for the emergency people to come so that you can do what? They can do that. Airway comes first, because the 100% of people collapses because of lack of oxygen. Lack of oxygen in the respiratory surface. And you see, the only way you can lack oxygen very fast is through strangulation. Then you fail to do what? To breathe. You get it? We're going to step three. Today's topic is nice. We're going stepwise by stepwise. Step three, look at the chest movement. You remember what we talked about the chest movement? The normal chest movement moves the opposite direction with the abdomen. So when you breathe in, the abdomen becomes big. Yes, when you breathe out, the abdomen goes up because the diaphragm comes up. That is called normal breathing. But there is something called paradoxic. When you breathe in, the stomach goes in. When you breathe out, the stomach goes out. You get it? So now you can check those things out. You can check those things out because they are very important. They are very important, and it is important you do what? A minute, someone is calling. Um, minute, someone, yeah. Yes, you can check that one out, and then you do what? You save this person's life, and you continue. The chest movements are very important. Chest movement. Listen to breath sounds. Breath sounds are very complicated at times because when you breathe and then you feel the crackles, there are some crackles in the chest. You see, they are called crackles. They are called crackles, or you breathe and then you hear a ronka. You can hear them by sometimes even if you touch the chest, you will feel them. You will feel them. You will feel the problem. You see, now we check the respiratory. If there's some when there was COVID-19, people bought the pulse oximeters for themselves, and they were trained on how to check the oxygen levels. So you check the oxygen level if you are trained and you know, so that when the emergency team comes in, you already know the the you already know the oxygen levels. You tell them the oxygen levels is like this. You'll be making easy for people of for the other emergency team to do their work. High flow oxygen is breathing inadequate. We get it. High flow oxygen is breathing inadequate. You get it. Bag mask ventilation if needed. Now, medics comes with these things, but you see, maybe you can be a medic and then you are using these things in your house. Now, we have dealt with airway, breathing. A, B, C is circulation. C is circulation. Now, circulation is whereby you check the pulse. Mhm. You check the pulse, you check the BP, capillary refill here. Because if your blood pressure is okay, the capillary refill will be instant. But if it is not okay, it will not be instant. You get it? Look for bleeding or shock. Is this person bleeding anywhere? Because bleeding can cause low circulation. Bleeding can really cause low circulation. And it is not it kills within some seconds. If you massively bleed, you can die very fast. Get it? Now, the other thing that I want to say, those ones are for medics. If there is massive bleeding, they insert an IV line. They insert a granule. I don't know if I have it one here or it's in the. Let me check if I have one. What is called? Someone knows it. Granulas. There are different types of granulas. You may find a pink one, a blue one. You may find. Yes, I have one. I have one here for young adults, and this one. This one is called a granule. This one is when someone intravenous use. It's for intravenous use when we want to insert drugs in the system using your veins, or we want to insert drugs in the system using interaction. Some we get to the knee and then we put this one, and then we rehydrate, or we do what? We give you blood. Villians send blood samples. This is now is in the hospital. You get sample of blood to see what is the problem. Is there any intoxication? Is there any problem somewhere? We do. We see when you lose a lot of blood. When you lose a lot of blood, what happens is this. We may want to give you blood. We have to get your blood type. We have to screen if you have any condition. That's why we take this blood to the laboratory. You see, it's very important when we do these things. Hmm? Correct IV fluid for hypotension. So when you are unconscious, it's likely that we may find that your BP is low. You get it? So the IV line, the lines that we give, this one, the yellow one is for this is for young kids or people with small veins. When we do it, we give you fluids so that your pressure cannot go down. That is step 4. This is in circulation. We correct your BP. Most of the people, when they are found unconscious, lying there, you see, these are secrets to saving lives. Check the BP first. Nowadays, things have progressed. So people have their BP machines at home, pulse oximeter to check oxygen. People have them in their homes. You see, it's very important. But when it comes to things like inserting granules, unless you are a medic, let them be done in hospital. Sometimes you can find a person is unconscious and the temperature is very low. Cold extremities, cold. Make this person warm. Take a blanket, wrap this person as we call emergency team. Last week, the whole of last week, we've been talking about emergency, saving lives, doing this, and that. You see, so we are continuing, but for today, it's just assessment. You check the person. From tomorrow, we start dealing with cases and answering questions. I've got so many questions I have to answer. Yes, manage of arrhythmias urgently. Arrhythmias are when you hear your doctor saying that my patient has an arrhythmia, it means he's saying the heart is not beating correctly. Tachycardia, bradycardia. Tachy is when it is beating so fast, and you can touch and feel that heart. This person's heart is beating so fast. Or bradycardia is when it's beating slow. You check for that. There are so many machines that you can use, like echo, ECG. Yes, those are the things we check when a person is found unconscious. Disability. Now, we have dealt with circulation. We started by ABCD. Airway, breathing, we have checked the breathing, the chest, how it is moving, ventilation, is there any blockage around the respiratory surface, like this, those. And then we have gone to circulation. How is this blood flowing? Is this person bleeding? Around where the person was found, is there any blood? Yeah, you see, vomit is where you check on airway, because when a person vomits, he or she can be choked. You see? So we continue and say, after circulation, you're known that this person BP is okay, temperature good, IV fluids inserted. Before other big tests are done, we go to disability. Disability is neuro assessment, nerve assessment at the brain. You check the person's how the person is responding in the brain and the nerves. So these ones at time these ones you leave them for the doctors. They do something called Glasgow Coma Scale. You see, when a person is unconscious, we there are some things we do, like the Glasgow Coma Scale. By responding, we check for agreements, response to eye response, how you respond to speech. You get it? Are you coherent? Are you giving us some words that are not ending up? And you see, incomprehensive words. You see, are you oriented? You check on the eye movements. We check on response to speech, to pain. You see, those are things we check. It is called the Glasgow Coma Scale. So these ones are done by health medics and practitioners. You check for pupil size. Is it retracted? Is it moving? Is it moving on when you place a finger like this? You see, check the blood glucose. Checking blood glucose for if a patient is unconscious is very important step, because maybe this person is diabetic and this person overdid insulin or metformin, those medications that they are in. So glucose goes so low and this person goes unconscious. You see, it's very important. Step 7, thinking of the causes. What can make a person go unconscious? What can make a person go unconscious? We say A, E, I, O, U, tips. A for alcohol, E, epilepsy. Epilepsy is seizures. Those people have complication with seizures. We have insulin, A, E, I, insulin, insulin. Diabetics, they have maybe a person overdid and then the sugars went down, and even sometimes alcohol. This person drank a lot of alcohol. So you try and think what might be happening here. Oh, overdose. Overdose. Overdose may be several things, like you can overdo drugs, you can overdo some, let's say, some alcohol, you can overdo it. You see, over oxygen, lack of oxygen, you get it. And then there is uremia for the people that mostly are arthritis positive, and you see gout arthritis. Increase in uric acid, and then it makes you unconscious. You get it. We have tips, A-E-I-O-U, tips. Tips is trauma or tumor. Trauma or tumor. Maybe you slid and hit your head down. You get it? That might be a cause. Trauma or tumor. Maybe you have a tumor. Tumor grows in your head, and then it is manifesting by confusion, and you go down, you hit your head. You see, those are the things that can make you unconscious. Tips. So we have another one called EI. We don't forget about infections. Infections can make you fever go up, you get hypotension, your blood BP, blood pressure goes down, and then you go hypertensive, and then you go unconscious. You think of infections. Does this person has sign of infection? The first sign of infection is fever, high fevers. If you just go in your house, you find someone is unconscious, and then you tell that person has high fevers. You see, you think of infections, fevers, pyrexia. And most of these people, when you touch them, they are not sweating. And when fever is so high and you have an infection, you don't sweat. You get it. Now, we get to psychiatric tips. Psychiatric. Psychiatric means what? You know, when we talk about psychiatric, people think of mad people. Psychiatry is a big based thing. We have the one you say psych people. We have people that are undergoing normal stress and depression. That is not psychiatric, but you see, depression can make you collapse because of stress, brain. We have talked so much about mental health. For new people, we have so many videos of of our lives here, that you can go and learn about psychiatry and mental health. This one can make, you've seen people that are panic until they pass out. You panic until you pass out. So psychiatry is important. Think about this person you've met some days ago. He's always having problems, or he's bipolar, or panicking, or you understand those causes. And then one day you just find this person, maybe he was given, or she was given an information that made this person panic. And then the person responded by shock, and then the shock made this person go down and responsive. So psychiatry is that thing. So you think, I'm just jogging up your mind, and I'm just thinking about things that may you found of course, someone is unresponsive, has passed out, but now you are jogging your head, thinking of what might happen. And as you think of what might happen, you look around. You look around. Is there any drug around? Is there any insulin on the hand? Is there any syringe? Is there any drug like heroin, cocaine? Is there anything like alcohol bottle around? You see, we are a psychiatry. And then the last one, think of stroke. Has this person been having high BPs? Has this person been undergoing a disease that may make this person get a stroke or shock? Think of those things. So we have said the causes that may guide you to think of what might happen. You say A, E, O, U tips. A, E, O, U tips. The first one is alcohol. The next one is epilepsy, which is a neurodegenerative disease in the brain. Then we have I, which is insulin. We have overdose, drug, oxygen overdose, all those can make, or fumes, you get it. And then we have U, which is uremia. And then we have T, which is trauma, fall, hitting your head, or tumor in the head, or tumor in the head. And then we have infections. We have talked about infections. We have psychiatric problem with that involve mental health. And then we have stroke and shock. Now, step 6, you have just joked your head and you've listened to that. Now we have step 6, exposure and examination. Those are things that they are happening in the hospital now. It's been carried to the hospital. You expose the fully. Look for trauma marks. You look for needle marks. If you did heroin, needle marks, rashes. Well, maybe this person can get rashes if it is meningitis. You get it. And then alcohol or drug odor. Sometimes it can be drugs. Yes, some drugs when you take them, you think of that. You expose and find out after you've jogged your head with RAEOU tips. You jog your head. And then step 8, investigations. Now we are in the hospital setup. Every medic very ready to make this person's lives come back. What do? They take blood sugars, they do APG, blood gas analysis, electrolytes for the kidney to check if the kidney is functioning okay. We call it kidney function test, UECs, urea, electrolytes, and creatinine levels. You get it for the kidney. And then we see if this person is really not responding, we take this person to an MRI machine or CT scan. We check the brain if it is responding or functioning well, or if there is a lesion. A lesion is something that might have disturbed the brain not to function normally. And then we see toxicology screen. We take your blood, we screen if you have any other problem that might have led you to that. You see, after thinking and finding the things around, we have to take to the laboratory to be sure this is what this person did. Now, that is a secret when it comes to assessment of unconscious person. You see, we started from home and we have ended up to the laboratory in the hospital. We started by airway. We checked the breathing circulation. With the breathing system, we checked the circulation. After circulation, we checked if there is disability, and then we thought of the causes. We checked around, we checked if there any alcohol bottle, we checked if there is insulin. Does this person do any drugs, infection? Was this person coughing before I left? Infection, is there any fever? We talked about mental health and stroke, and then we have gone to exposure. Now we are in the hospital and an ambulance has arrived. The medics are there, fully compacted to bring this life back. Exposed. Then as we do IVs, investigations in the laboratory, and then everything becomes very fine, very fine. Yes, that was a very short session of assessment of unconscious patient. Maybe at 9, I'll be talking about thinking of the causes. If there will be time, it is very important about it. mm, about it. But remember, never miss hypoxia, and stroke. Not big words. Wherever you are, every person, wherever you are right now, be blessed. Thank you for tuning in here. And please help someone by sharing this message. See you at 9. Be blessed.